Going to talk about advanced care planning this morning. April is National Healthcare Decisions Month. And when you're getting a little long in the tooth, like some of us, you have to start thinking about these things. We've got two great guests here. Scottie Gaskins is the Senior Administrator for Wellness for Vidant Health. Scottie has been on the show before. Good morning.
Good morning.
How
Thanks
are you?
for
Good to
having
see you.
us today.
And I just met Dr. Jay Manning, who is Director of Hospitalist Services for Vidant Health. And I hear you're an Eastern North Carolina boy who's come home.
I am from
Good to see you.
Beulaville.
And I was just thinking about this because for people who don't know what a hospitalist is, they're the doctors that you see in the hospital, and you're in charge of all the hospitalists. You got a big job.
Yeah, in charge of them, but I don't. From day to day, I don't tell them what to do because they
tell you
it's
what
more
to
than
do?
I can do. Yeah.
Well, if you got we were just talking about Vidant is now a 1,000 bed hospital with the addition of the cancer center. How many total hospitalists are there in Vidant Medical Center?
At Medical Center, if you include doctors and nurse practitioners, we're up, 60s, 70s any given day.
Is that right?
Yeah.
Yeah. Is it like herding cats? How do you deal with that? I mean,
No, they're all professionals, and they all take care of themselves. Really, what I try to do is set strategy and tone. So we're about taking care of patients. We're about doing what's right for people. It's so big, but when you go in the room with a patient, you close the door behind you. It's you and the patient, and you take care of them. And that's not always an easy job, but it's easy to get motivated behind doing that.
I was just relating stories about my mother, who was actually at Vidant Medical Center right before Christmas. She had pneumonia, and she saw a lot of hospitalists. It was a great experience. I mean, I think we should get down on our knees and thank God every day for Vidant Health being in Eastern North Carolina with unbelievable medical service. I know everyone doesn't have a great experience because people get sick, and when you're sick and you have loved ones that are sick, sometimes things happen, and it's hard, but I think Vidant Health is an incredible place, and we're so lucky to have it. So thank you for all that you guys do.
Well, thank you. It's really an honor to be able to take care of the people of Eastern North Carolina. That's what we're about and what we get up in the morning to go do. So,
All right, we're supposed to be talking about advanced planning. So people dealing with end-of-life issues can be very difficult. It's hard to talk about, and people during the month of April every year, people are encouraged to do it because it's National Care Decisions Month. And you see patients, Dr. Manning, when they're in the hospital, and you see older patients. Talk about that experience a little bit and what people should do to prepare when they get to a certain age.
Well, it's hard to prepare, and you say a certain age, and that's true, but actually, when you're in the hospital, you see people all ages that come through, and they didn't know what the day's going to bring for them, and they're in the hospital. And maybe they can make decisions for themselves, or maybe they can't. And so it is kind of hard to talk about, but it's very useful, and it doesn't have to be a heavy conversation. It does not have to be terribly somber. It can just be talking to your family about what you want. I'll tell you, when the rubber hits the road, I'm in the hospital, somebody comes in, maybe it's sudden, or maybe it's not really that sudden, but it feels sudden. It always feels sudden when a loved one's sick. And then they can't make decisions for themselves. They can't tell you what they want. Maybe they can kind of do it, but you're not certain. So you look at the family and you say, well, what do you think your loved one would want in this situation? And if they've talked about it beforehand, it's a lot easier. It's a lot better for the patient because the patient gets what they want.
Yeah.
And it's a lot better for the family. I don't know if you've ever been in a situation where you had to make a decision for people and you had imperfect information, but it's nice to be able to say, mom or dad or whatever loved one, they told me this is what I should do.
Right.
And so I'm going to do just what they said, as opposed to guessing for yourself and hoping you made the right decision.
I'm sitting here listening to you talk about that and realizing that, a few years ago I was faced with a 96-year-old aunt who ended up not expected, not a gradual decline, but, she had an accident and she ended up in the hospital. We were all in there trying to help make decisions. And I got to say that, again, the doctors at Vidant were very helpful to us during that period of time. So, but I get your point. What you're saying is you're encouraging people to have these conversations before they get in that situation, right?
That's right.
Yeah.
That's
okay.
right. And I'll tell you, doctors are people too. I got family. and had illness in my family. I've had a loved one with a tough diagnosis, something that's, maybe over the years not going to go well. And the first thing she did was come to me and say, look, whatever happens to me, I'm going to trust you with this. I want you to make sure that, the way she puts it, because we're from people, she said, I don't want you to have to do for me. And what she meant by that was she didn't want us to have to take care of her if she got in a position where she wasn't able to do for herself.
Right.
And that takes the burden off of her, it takes the burden off of me.
So I read somewhere that you can that Medicare will actually pay for a consult with a doctor. Is that true?
That is true.
Do you encourage people to do that, make an appointment with a doctor to talk about it?
I encourage people to do what they feel is right for them. If they feel like by talking to a doctor they can get information that's going to help them make a decision, then yeah, they should. If they know what they want and they have a good relationship with their family, then they should just talk to their family today.
Let's talk to Scottie. Scottie Gaskins is senior administrator for wellness at Vidant Health, and as part of this special month in April, where you're encouraging people to talk about end-of-life issues, advanced planning, Vidant has some things coming up. Scottie, tell us about that.
We do. We actually have events all year long, Henry, not just in the month of April, that help individuals across our communities complete their advanced directives. We have trained facilitators. We bring notaries out. It's completely free, and someone can sit and have some assistance working through the legal documents that are considered advanced directives. And that's important, that you don't just talk about it with your family and your providers, but you take that extra step to document what your care preferences are in a legal document.
Who needs to do this? At what age and what's the situation that arises that people say, okay, now is the time to go get this done?
Well, I have rather surprising news, but frankly, we're all going to die one day. I know that's a shock to everybody's system, but it's a reality.
Yeah.
And so the reality is every adult should have an advanced directive. Dr. Manning's even already mentioned, sometimes it's not about age. Sometimes there's a sudden accident, there's a sudden illness that can affect anyone at any age. And in those circumstances, it's important, regardless of the age, that their family, their providers know things about that individual and what matters to them about the care preferences that they would want. When it's been documented in a legal advanced directive and we have it on file at in their medical record, that gives us even more assurance that we can follow the care preferences that individual stated.
So you file it at the hospital, and it's there if someone has an accident or an illness, and because people aren't going to scramble around looking for paperwork at that moment. You go ahead and file it with the hospital in advance.
That's right. So a lot of people make the mistake of tucking away their advanced directives with their will, and that might be in a safety deposit box or
That's right.
that type of thing. We need those advanced directives in the hands of family members, number one, and secondly, it's ideal if it's also in the hands of providers. So when the time comes that the providers and the family need to have conversations, they're all working off of the same set of information that the individual took the step to document. So we're actually able to scan individuals' advanced directives right into their health record. Certainly when you're at your doctor's office or you come to the hospital, you can bring it, we can scan it. But at these community events, we actually have the ability to scan it right there. It goes right into a queue for our medical records department to load into your health record.
How do people find out more? I'm sure you've got some information online somewhere.
Absolutely. We have vidanthealth.com/advanced care, and anyone can go there and find a listing of upcoming events all over Eastern North Carolina. You can actually download a free toolkit for advanced care planning on that website that includes the legal documents that someone would need to fill out, and all that's free. The other thing, Henry, is we love to get invitations to go out to churches, work sites, community groups. You don't have to wait to come to Vidant in a hospital or a physician practice in order to get this help. We'd love to come out and provide these same advanced care planning clinics and advanced care planning education in your own setting with your groups. So we love an invitation.
Great idea. Contact Scottie Gaskins. How do they get you to do that? Have you got your email available?
Sure. Well, actually, we have an advancedcare@vidanthealth.com email. So we would love folks to send us a request.
Advanced care
at Vidant Health. vidanthealth.com.
VidantHealth.com. Easy enough. Dr. Jay Manning, the Director of Hospitalist Services. Now, are you over the hospitalist for the whole system?
Whole system.
Man, you
so
have a big job.
We got Tarboro, we got Edgecombe, Beaufort, which is where I originally started practicing, Outer Banks, Edenton, Duplin. Oh, man, if I leave somebody out. Lenore and Hosky, thank you.
And they're listening up there.
I know they are. Yes, we do. But we have local directors at every place. So
Yeah. Well, great. Well, this has been very enlightening. And if you missed any of this, we will rerun this interview on our Greenville Vital Signs program on Monday night at 6:30 on radio and TV. And it's always going to be available as soon as Michael gets it up, probably later today on greenvillevitalsigns.com. So thank you to both of you, Scottie Gaskins and Dr. Jay Manning. Thanks for all you do, and good luck with all the events this month in promoting advanced planning. Thanks for being here this morning.
great, thank you.
Good to see you. Thanks to
for
Erica.
having us, Henry.
Thanks to Erica Mizell, also my contact that keeps me straight over at Vidant Health and sets up these great interviews for us.